Heart failure is a complex chronic disease that often results in visits to the emergency department, lengthy hospital stays, rehospitalizations, and premature death. A typical heart failure patient presents to the emergency department with shortness of breath or swelling of their limbs. Given the acute nature of heart failure symptoms, it is critical for ED teams to quickly assess and determine a safe patient disposition. Evidence confirms that some high-risk patients are discharged from hospital, while some low-risk patients are admitted unnecessarily. Decision support tools can help quantify risk and facilitate consultations with the appropriate service regarding discharge or admission.
Managing heart failure patients in the emergency department can be challenging because the symptoms that they come in with are vague and they overlap with other conditions, and there's a need to collaborate with other physicians and services in order to manage their acute episode. Quick triage, standardized investigations, and early diagnosis can lead to reduced mortality, morbidity, and improved patient satisfaction.
The Emergency Heart Failure Mortality Risk Grade, or EHMRG Score, can support clinical decision-making for patients with acute heart failure.
The EHMRG Score is an important tool for clinicians because it helps doctors make better decisions about their heart failure patients who present to the emergency department. In particular, it helps doctors decide whether the patient's high risk and might need to be admitted to hospital, or whether they're low risk and could potentially be discharged home. This intervention reduced the risk of death or cardiovascular hospitalizations by 12%, which was statistically significant. We used 10 variables to calculate the score: the patient's age, the patient's oxygen saturation, the patient's systolic blood pressure, creatinine levels, the patient's heart rate, whether the patient arrived by ambulance, whether the patient has active cancer, does the patient have elevated troponin, does the patient have a prescription for metolazone at home, what is the patient's serum potassium, and optionally, what was the patient's BNP.
This evidence-based decision-making tool can help optimize care for patients. It means that patients who can safely be managed in the community can be managed at home, and those who are very ill can be managed in the hospital.
To use the EHMRG score, once all of the laboratory test results are back, you can simply enter the variables into the calculator and very quickly determine the risk score based on their clinical characteristics.
Any clinician can generate the score online. The clinician enters the 10 values for their patient, and the 7-day mortality risk is calculated. 2 more data points are needed for a 30-day mortality risk. In certain institutions, the score can be auto-populated by electronic medical record software such as Epic. The EHMRG score generates a range which correlates to a low, intermediate, or high mortality risk at 7 days and 30 days. Low-risk patients can be safely discharged with referral to a heart function clinic or to a cardiologist. Those with intermediate risk scores may be eligible for discharge with a cardiology or heart function referral. They may also be admitted for short stays in the hospital to be stabilized before discharge. Patients with high risk scores should be admitted to hospital in consultation with the appropriate service, such as cardiology or general internal medicine.
Heart failure rates are increasing to epidemic proportions across Canada. This, of course, means that there are more presentations to emergency departments with heart failure complaints. Clinical decision-making tools like the EHMRG score can help us increase emergency department flow by determining which patients are safe for discharge or require admission to the hospital.
Learn more about the EHMRG score and access additional resources to support implementation in your institution at tedrogersresearch.ca/emerge.